Devendra Pai.
Jinendra, okay, let's start. Good.
Let's start.
Hi, everybody. So this is the research part, as we're trying to do. We had a couple of good talks on diabetes, good discussion. I think we hopefully have a better grasp of what this is. And this will be taped, you can play it back, but we'll go to this one. Good. So let me just see the page down. So again, we emphasize that we're complementary to healthcare, right? So we are particularly not going to compete with it or try and do this instead of a way to delay, but aid and complement and almost be a synthesis. And the healthcare system is going that direction also. So there's less and less challenges, more what is evidence-based, right? So that's kind of one. The reason I'm presenting this in evidence-based is that the physician on the left will only be allowed to inform or can apply it if there's evidence that's met criteria. Just because we believe it and we've shown some numbers, it doesn't mean they will change their practice, because they have to speak to higher evidence so that they can work with their patients with trust. Okay, so this is one of why we focus on randomized controlled trials, which are, while they're not basically good enough yet, but they meet that question more than the other studies we talk about. So I'm going to talk about those and many other papers, but I'm stick to the ones that are quality and randomized controlled trials. All right, so we're going to talk about prediabetes. Very important that maybe a far, far bigger role for what we're doing in prediabetes to try and stop it in its tracks. Prevention is always well worth its weight in gold, you can imagine. Then, of course, when you have disease, how it can help its management and improve it. We'll talk about the different issues, some mudras or not, and key tables, and some guide for trainees. Okay, so this is a nice simple map just to kind of put us in the point where we are. So in the middle is a human with the pancreas, which is the beta cells. There are cells that live in the pancreas. The pancreas has two parts to it. The part that makes insulin is the beta cells, and they will control your sugar, right? They sense it and control it. So they're like your automated sugar control, like you would imagine, like your homostat in your home, the heater or temperature stat. This is what this does. And a lot of messages go back and forth for this to work. And generally, why does yoga even work? Why would it work? Well, we know yoga is stress reducing. We talked about it. Remember the HPA axis, relaxation, less cortisol. So basically, if you look at the top line, yoga will reduce your stress HPA axis, which would then lead to less cortisol, which means less glucose. So your blood sugar isn't that high, and therefore it helps you control, right? Yoga also improves how well your cells can respond to insulin. This data is showing that you can actually change its ability to improve how well it responds to insulin. That is the GLUT4 translocation. These are, again, studies. Meditation also does this in a slightly different way. And it may be a larger effect in stress reduction than the sensitivity, but it clearly helps also, stress being such an important factor here. And mudras are usually part of the whole process, so it's a little hard to know if they work independently, as we'll see. But they clearly have, in terms of yogic wisdom, ancient wisdom, target your pancreas, even your liver, other organs, and they improve your sensitivity and go to them, also how well your pancreas works. So all those together, you can imagine, would have a powerful role in this setting. Okay. All right. Good. So then, stress, right, is sympathetic activation. That is, we talk about the Eden Pingler rate. We talked about that. The right side is your sympathetic. And when you're stressed, which is your left brain, you're going to increase that drive. We've been talking about all along, right? The key factor here is to control that and enhance the parasympathetic. And now sympathetic drive in general with stress will reduce your blood glucose, right? It'll do many ways, adrenaline, your cortisol, not just cortisol, I mean, adrenaline will do that. We talk about cortisol is chronic, but adrenaline will also do that. And we know yoga meditation works. It balances the system, sugar. So you already know the key. You already many times understand the key, so you can see why this would work. You could almost always imagine already what you would do and how you do it. So I bet you all have a good general idea of how to treat this, and you'll probably be 80% right without me telling you a lot. So you should have understood this really well. All right, so prediabetes, again, I'm a big fan of prevention, and this is a far larger population than the ones who have disease, you can imagine. So there have been some major clinical trials of this, luckily, and they have been in India, actually. There's a large Indian trial, tested yoga lifestyle in over 3,000 adults across 80 communities all over India. And there are 9-day initial yoga training, daily home practice, and weekly classes for 3 months. After the trial, only 11% of yoga progressed to diabetes. This is a pre-diabetes, right? Versus 32% controls, which shows a more than 64% risk. There cannot be a better study than this, right? You know, the experts taught them, you know, they did a good job, and the results were objective, okay? So it's a really, really good trial. And that itself is enough data that we should be using this regularly. Ourselves, our family, because, you know, as you know, one in many of your family is going to get this. So even if you do this just for your family members, you'll have a huge impact. Forget any immediate family members you're surrounding. This is a very important trial. Okay. And another study was a randomized controlled trial in Chandigarh, which is again a 3-month diabetes yoga protocol for high-risk adults. So again, they hadn't got diabetes yet. They're pre-diabetic, but high risk. Risks that we mentioned yesterday, or Really Doshi explained to us yesterday, the day before. So in this, yoga participants showed reduced post-meal blood sugar, lower LDL cholesterol, the bad one, and then over time, their waist size improved. So clearly, it can stabilize the blood sugar, reverse prediabetes because they improved, and again, a cheap, cost-effective way to prevent disease in the population. So it complements diet, physical activity, of course. It's one more agent, but in itself, it is very effective. Right? So another reason why everybody should do this, all Indians, South Indians, Gujaratis, Punjabis, all high-risk diabetes, which all should be doing this because they're all heading that way. Okay. Good. So if that's the one message you get, that's all you need to learn. Stop everybody from getting diabetes. That's going to be a better gain. Once you get it, you're going to need the doctors, right? But this could be before you get to the doctor. That you don't need a doctor for. Once you get that lab and they get the pre-diabetes, if you do this, perfect, fine. Because the physician's not going to do anything except advise and wait for them to get diabetic. All right. What about if you get diabetes? Again, we talk about type 2. Type 1, we don't really think yoga has a big role, though any chronic disease where you have to be restricted on diet, you get shots, you know, you have to take the shots. There's a lot of burden to your life, right? And your life is chronically affected. What can eat, can't eat, the instructions, the orders, the freedom of life goes away. And most humans can't handle that. They will break down here and there because of that chronic stress. So that is where we do use yoga and meditation in chronic diseases to help them manage their burden better, and probably will make them more likely to take the insulin shots, more likely to take the diet appropriately. And then, yes, we can help impact. So this is where in the type 1 diabetes, which is their pancreas doesn't make insulin, they need insulin shots, we can still help them do a better job with their treatment. So it's important there as opposed to affecting your sugars per se. Okay, so that's important. But we now talk about the type 2 diabetes, which is the one that we mostly focused on last couple of days. All right, so there are quite a few studies, and this is a meta-analysis of all studies that are of good quality. And if you look at all of them, on average, your HbA1c, that's a number that about 5.878 is normal, and 8.9, you're really diabetic, and somewhere between that and 7, you have problems, but you're slightly better off. So reducing by 0.5 is not bad, right? This was what diet could do. So again, it's not going to reduce your 9 to 5.9, right? If you're 9, it's going to reduce it way. So it's an adjunct, right? It's an adjunct that's low cost, easy to do, and has other benefits, not just glucose control. So it should be part of the therapy, it should be a complementary part. In itself, it cannot handle the whole burden of diabetes. Now, there are 3-month studies, and I can imagine if you are a yogi, you do it for years, you also lose weight, probably there you will see a better effect. But we talk about the vast majority of people that we're going to treat, then this would be a reasonable goal. It shows lower fasting and post-meal glucose levels compared to healthy controls. It's more effective than walking. They compared yoga with walking, and it's more effective than walking. And it shows a trend towards lower fasting insulin levels, which means that your body is getting better sensitivity to the insulin it's making. Remember the plot I showed you where the muscle and yoga helps improve sensitivity? So this study showed the same thing. So the exercise makes your system and responsiveness better. No, except yoga, better than exercise. Yoga. Exercise will do it, but yoga is better. Okay. And we'll talk about what they used at some point, about what kind of techniques they used. All right. So that's and stop anytime for any questions. All right. So this is how much of the HbA1c it reduced, right? So this is the second study, which showed a reduction of 0.45, is almost half, versus the ones who has regular pre-diabetes kind of or control and regular exercise and stuff. They got 0.1. So this is better than exercise. Other treatments are the same. This is just these two changes were made. Again, this was a control randomized, so we don't know confusion or picking the better cases for one versus the other. This is a very, very well done study. All right. So long-term studies, there's a 1-year-old study. 1-year study showed that your HbA1c can go down by 1.25. Right. So if you imagine you're like 8 A1C, which is quite high, poorly controlled diabetes, you go to below 7, which would be fantastic, right? And it's more than exercise, right? And of course, they also showed that your mood is better and you're slimmer, and your Medicare needs dropped. So as somebody says, sometimes it can get close to what we call a cure, but again, you want to be careful about promising that, because individual journeys are going to be different. But there is promise, in a sense that there is potential. Short-term yoga, of course, we already talked about. So another study showed reduces blood pressure and stress. And then another study shows combining, just one second. Another study shows combining diabetes self-management, mental health and quality of life, and wellness. So it's not always about the sugar, but also how well you feel. Okay. All right, and then how does it work? Again, we talked about the
Dr.
different.
Devendra.
Go ahead, Rakesh.
One quick question.
Mm-hmm.
On the previous slide, this one and the few previous, the general question is the control group. How do we define that control group? Is that the group which is taking the medicine, and on top of that, the yoga program was imposed, or is it no medicine involved? I mean, is that half 0.45% reduction compared to no medicine at all?
No. This is on their regular medical therapy.
Okay.
And correct. So both groups have regular medical therapy, and they get into the intervention. And over time, if the physician sees the ability, they will adjust the medicine as they would anyway. And so they're not asked to. It's just nature of when you see a patient doing well, they might reduce the medicine. And in that way, they found, in at least one particular study, they found that the drug needs were dropped, this 1-year study. Okay. But it wasn't, they weren't told to just realize we better, so just cut it back. Right? But yeah, you have to have your baseline therapy. That would not
Right.
be.
So the medicine in that the next slide with
Yes.
the
Yes.
bars, the
Yes.
medicine was only partially effective, 0.1% reduction in diabetes.
No, that's exercise. In that bar, you're comparing with exercise
Yeah, this
versus
one
yoga.
here.
Yeah. But yeah, basically usual care. And they were told to exercise, which was not monitored. And here they did yoga. Okay.
So okay.
Does that answer your question?
Not entirely clear. So
So,
the
so what
blue,
in this
the blue,
group, they basically had medical therapy and they were told to exercise as routine, normal exercise you would expect any healthy person to do. This group, they were told the same, but they added yoga. The
okay.
medicines, regular exercise, and yoga.
Both groups were suffering from type 2 diabetes.
Correct. Yeah. Basically, they started with type 2 diabetics.
Yeah.
And then randomized them two groups.
Right.
And then one group had regular care and told to do good exercise, like generally you would advise in a regular clinic. Like everybody with type 2 diabetes, they're told to do diet control and exercise, right? As part of the routine of care.
But no medicine involved here.
Medicine, both are medicine. Both are medicine.
Both have medicine. So
both are medicine, correct.
Yeah.
And they control, yeah.
When I read this graph, the medicine with the blue bar, even though they were taking medicine and doing regular exercise, it was only partially effective, that program. But then you said
change, correct.
Right.
The change was partly correct over the baseline. That is correct.
Right. Okay.
It doesn't, so you can imagine they're already in medicine before they go into study. So they probably had decent numbers, like, 6.
Okay, so the
zero
zero would represent just the medicine, the baseline, right? On top of that, the regular exercise improved it a little bit.
Correct.
But the yoga program reduced it by much more.
Correct.
Yeah. Okay. Okay. Yeah.
Good question.
Thank you.
Yeah. And the 1-year study did the same, but the physician over time found those patients with yoga needed less dosing of the medicines.
Yeah. Okay.
Because as you see, and you adjust, right? When you see a doctor, it's just based on blood pressure, you adjust your medicine. So it's based on metrics that they see. And these are blinded, so they don't necessarily know that they are getting yoga, right? So the physician's not aware of what they're getting.
Yeah. Okay. Thank you.
Good. Good question.
Yes. Thank you.
So as we talked about, we already touched the mechanism, but I think what's interesting in come out of the studies is that the muscle glucose uptake does boost diabetes control, which is seen in other exercises, but without the exercise, even just the simple poses, in a sense, less effort. And of course, we know yoga can give you slight weight loss and reduce the fat in the middle, because that's a fat that's in the pancreas. So when you see fat central obesity and this is why Indians and have a problem, is our fat usually tends to be central, not the thigh or the buttocks, but here. That's where your organs are. So that's going to be where your pancreas has, and that's going to be your heart has, and your liver has, and your vessels. So you can see that we are more at risk. And that's why yoga is so good for us, right? Plus 3 cousins, because we will work on this central fat, which is exactly, so if this fat goes down, the fat in the pancreas is going down, the fat in the heart's going down. So think like that, you understand why it makes so much sense to focus on that. All right. And then breathing and meditation, right, can lower cortisol and the sympathetic activity. So it adds to better control, right? So you can see how we're building on blocks. And then if you're mindful, then you're going to stick to your diet better and your medicines better. So you can see different parts of the package are bringing different parts of you to be able to address your need, right? So they're adding different dimensions, which is like the diagram I showed you. It's very important to think like that. So each of these are important. I may have a study, but if not, they found that if you just did mindfulness, the effect was more on your mood but not so much on the actual glucose. If you added your yoga to that, then you add both benefits. So it seems like they are different parts and you need to combine them. It's very interesting. Now, we talked a little bit, and some of you mentioned, so I looked it up a little bit, because this, what is soleus muscle? That's your calf muscle. That's part of your calf muscle. And I think I may have a diagram on that. Yeah. So this is your soleus muscle, right? And our muscles are basically two types of fibers, simple to understand. In the soleus, 90% are rapid sugar burners, where elsewhere the ratios are different. So this is a good muscle to use after you eat because it'll burn sugar really fast. Okay? It'll take up sugar and burn it really fast. So what this study in Houston by a physician was this: you sit and you push up. It's low intensity and you hold it. It's not the physical movement, it's the holding. You hold it in place so that that muscle stays tight, and then that burns fuel. And then they showed, and others in Europe have shown also, that you improve your glucose metabolism, which is burned more efficiently. Your insulin is more sensitive. Your cells are more sensitive to insulin because of the same thing we mentioned earlier, and net results is lower blood sugar levels, right? So it's a very powerful technique. So a good study. So this is something that's not known. It's just become the paper came out just a few years ago, so it's a big thing now on the internet, and which is good. Though I think they need to be pure to what was done in a study. They kind of then extrapolated to different methods, which may work, but again, you have to be pure to the studies. So of course, it'll enhance your strength and flexibility, balance. So it's a good thing to do anyway. And yoga does that. And I'll show you how, right? Because if you look at it, you know, a lot of your yoga poses like Tadasana, Vajrasana, and you sit longer, they're actually active in the same muscles. So, and they're good ones for diabetes. So I think it's not there, but this is a power of doing a study properly, right? Doesn't know what we have for thousands of years, and we know it works. I only can convince you because you trust me. This paper convinces millions around the world, right? And it's not that difficult to study. Think about it. All they did is this and measure sugar, right? In one group, they didn't put, the other group just sat, and they found the difference. And now they've stole the show, right? So everybody knows about this, but not. So I just want to make you think about it. What we are doing, losing, and you know, we learned about. Remember, with the women's health, we learned about the method that this doctor used. I cannot imagine a million years he did not know about yoga, because it's the era of knowing about yoga. But he used that for women's health, and the name goes to his name goes on that as a technique. So this is just one of those, you know, stories. Just be very careful about how the culture and the ideas are taken up and stolen sometimes, you know. And it's partly us not being aware of the rules of the world and how to engage them. All right, good. So anyway, this is important. And as I say, in summary, then it's no question, good, solid data, this works. However, for it to become common practice in every physician's office, it needs another larger study, just the nature of the world, probably in the West, before they'll apply. And that's just some bias, because the quality and rigor is not the same everywhere. So our FDA will almost always prefer American studies, maybe towards some European studies will tend to not favor other ones unless it's absolutely well run and well monitored. So that's the nature of the rule of the world. And then it won't be late papers and recommendations, even though we might maybe an Indian recommendation, but it'll be lost worldwide. Okay. All right. So mindfulness we talked about. There's an 8-week nurse-led program. It wasn't very large, but they did control it. And this is the one I was telling you, they actually helped the mental health, but did not help the sugar. So it shows you the different things are working in different ways, right? So it's very helpful. Should do it. You're more controlled in a sense of you're better off in managing your disease. But the physical part, and maybe the pranayama, will help your sugar. This is just the mindfulness. So you need a combination. All right? Good. And so in general, when you combine all those outcomes, it seems to be more diabetes related to stress, depression, anxiety. But the result on the sugar control is mixed. On average, very, very little direct control. So, and it helps you understand how it works. So it's interesting. All right? Good. So again, this is the overall view. Mindfulness reduces stress. Stress can affect blood sugar, but you need a combined program. So this basically is someone, yes, in theory, it can, in practice, you don't see a huge effect. So theory doesn't always work. You need something more physical to make an impact. And what about pressure at the end? Well, there are studies pressure at the end. Again, they're not bad, but as I say, they have to meet that criteria. So you'll see they're published in journals that are not peer-reviewed or not one in a standard search. And there is some bias, I guess, in the study, which is unfair and needs to be corrected. So even the study may be good, they have difficulty publishing in the Western journals. So there's this inherent bias, which I think is fair. But anyway, it is what it is. But this study, when it's in Journal of Yoga and Allied Science, had 40. It's not a big size. Again, this is a problem, right? 40 is not impressive in thousands. But they did show that the blood pressure, glucose, inflammatory markers, and lipid profile did improve. So if you look at the group before and after, and they found differences that are small, but some are quite important. Triglycerides, total cholesterol, triglycerides. This is good cholesterol, HDL, and this is your low density bad cholesterol going down. So they found it's a trend that was positive across board. Okay. And there's a PhD thesis in Ladnun that also looked at it and showed good general. It concurred with the findings. It's not itself a standalone, but it shows that what we're doing will work also. Okay. All right. Well, mudras and somebody mentioned acupressure. So I'd quickly look that up a little bit so that we can at least talk about it. It's not part of the course, but it'd be interesting because I think it's an interesting area. So traditional Chinese medicine and acupressure philosophy is, as you know, is about the qi and meridians. And it also works through the HPA axis and nervous system in general. So if you look at the markers, the work is similar. And they are better studies in acupressure. Not enough to put it in regular practice, but enough that you could say, you know, this is a good experiment, that it does reduce blood sugar, as somebody she mentioned, and stress, and aids in diabetes management using non-invasive techniques. Right, so they are good data, and I'll kind of go over one of them, a couple, just to get a sense of what it is. So in one study, again, there are not a huge sample size, only had about 40, less than 40. They randomized patients to with type 2 diabetes, same medicines. And 66 patients, they had two groups. And they had a acupressure group and a group that had some pressing somewhere. That's not a point, just so that the patient would know. So they did one way is the correct and one is an incorrect one. And then they did a study analysis. And they use the ones they use are the LR2, which is just here, your big toe, just inside of your big toe. And they use the Hegu 2, which is what somebody pointed out, which is here where somebody pointed out. And they press in, I think sometime, I forget, 60 seconds, apply pressure and increase gradient until the nail color changes. So your nail color changes, which shows you enough pressure. So it's about 3 kilograms pressure over time you have to press. It's quite to a point where it hurts a little bit. And your nail color changes showing the distance of pressure. That's kind of how they do it. Obviously, be trained. I'm not saying we should do this, but just to aware what it requires. And in this study with this, they did show benefit in glucose. So I think it does require more work and more training if that's something you want to add to your repertoire, and why not? Mudras are difficult because, as we talked before, they're very almost. I don't think there's any studies where check mudras by itself like this. It's part of a package, so it probably does help, but you cannot separate and say does that work or not. The Chinese study shows that this can work by itself, but we haven't seen any. There's no study reported in our any literature I could search with the engines to find anything. However, there are healthy volunteer studies which affects the autonomic system in a good way. So you could imagine it'll work. So it's not they won't work. We're just saying where the lack is. I don't think that this means we won't apply it. We should apply it. And these are mudras that studies have used. And we'll summarize it at the end. But the pran, we know all of this. We probably don't know the Lingam mudra very well. We don't use it very often. But that's the one that we do. And one thumb goes up like that. So that's the Lingam mudra. Apan mudra we know, and Gya mudra is all we know, and probably even Linga mudra we know, but the others we've done in many times. Okay, and it kind of makes sense. And when we do them, we kind of talked a little bit about them. We kind of mentioned diabetes here and there. So, and some are just to make you better mood and more focused. So, combination of these things. These have been in the studies we referred to earlier. All right. Again, lack of evidence, but it does relax, reduces tension, so it should work. So we should use it, but just be aware that that itself has not been studied. Again, in case you want to study one day, or just your way, you can tell your clients that, well, this is added, should help, but independently has not been studied. So you're factual if the question comes up. Okay. All right. Next slide. Okay, it's a several key studies. Then we talked about it. Generally improves your glucose control yoga. Mindfulness helps your depression, diabetes, distress, but not particularly good at your glucose. We know that multiple studies combined together seem to show consistent effects, so it's quite likely true. We still don't have a huge study, though, to show physician, please do this every day. We don't quite get there yet. And mudras, as I mentioned, we're lacking some evidence, but it's part of the package and it's okay. Good. So practical guidance, again, risk reduction, right? You know that it does that. So you can tell people, look, it can improve your sugar, right? And if you continue, it'll reduce your fat and your stress, for sure. Confidence. You can tell them that because that's what it shows. And you should add it as a complementary part of your therapy. You might see a beneficial reduction in dose, might not, but you should not compete with it with diet and other lifestyles. Okay, it's an added piece. That's the verbiage. Inconsistency will not work, so we need to teach them how to be consistent, give them tips of how to focus and get their weeks in. Different people have different needs. Some people say when you brush your teeth, some people say when you go to sleep, sometimes when you come from work, you got to customize it. And then you will, over time, see benefit. So you've got to go to a point of even telling them when they should do it, because sometimes they will not do it otherwise. So you have tips. Over time, you develop these tips. For example, I will, in kids, combine with something they do for sure twice a day. So you know for sure they're going to brush their teeth twice a day, vast majority of the kids. So I'll add 3 minutes of routine to that, then they'll remember. You know, and then after the mother and the bugs them for 6 weeks and do it together, then do it forever. Then now it becomes a routine pattern. They brush their teeth and do this. They brush their teeth and do this. You know, but for somebody who's adult, may be different. But if you can try and put it on some other routine they must do, and you add it, that's often one simple way for them to not forget. Okay. So I've got a couple of infographics. They may not be perfectly correct, but they're just to summarize. So one way to do this is to, so one of the studies is from one of the studies, they will do a warm up for 5-10 minutes, all the stuff we normally do. Right. Very much like what we do our subtle exercises, some form of those. Then we do the standing asanas. Trikonasana is very a favorite one for the studies. And side bending is another favorite. And it can make sense because that's where your pancreas is. So it kind of makes sense. And then as you get better and better, do more and more. Then they'll do seated and supine versions. And all makes sense, right? Paschimottanasana, we already know makes sense because the pancreas is right there, it's pressing on it and massaging it. Gentle twists, right? And then prone mild back bends. Again, we're going to go with Rameshi, but I just want to give you a review. Cobra is, of course, very, very good. And pranayam, we will probably talk about with Samiji. And then Kaitsur, right? So nothing surprising. These are the ones they've used. All the things you already know. These are the ones they used. Very powerful. And then with regard to the breathing, these studies have used Anum Vilom, the Kapalabhati, about 5 minutes, 7 minutes. Primary, sometimes you alternate between days. Deep swash, special. In this case, deep diaphragm breathing is more as a physical than the meditative, but they do deep diaphragm breathing. And again, guided or guided, okay? And then these are the mudras. So the bananas know how to do mudras. You can ask them if you're confused. The bananas don't know how to do mudras. Forget that. They've got it wrong. Anyway, Pran Mudra, Surya Mudra, Ling Mudra, Apan Mudra, and Gyan Mudra. Okay, just to summarize. All right, that's it. All right.
Very nice.
Questions? This will all be recorded, right? So don't have to, we've missed some notes. And if I want a little fast, it should all be available. Any questions?
No, you summarized
basically,
very well, Dr. Devendra. I had question until the end, which yogasanas were used in the studies, but I think you covered that in the last 2 slides.
Yeah. I did that because that's easy to take, and we'll put that into the folder we're talking about.
Mm-hmm.
I'm creating these on purpose where they're ready to be put onto the diabetes sheet or the like that.
Mm-hmm.
So this is going to be easier to mount there because picture is easy to see.
Right. Did they define the yoga program in those studies, or it was general yoga?
They define, they say specifically what they use. Each study has to define,
right?
And they even have a handbook. If I go deep into the original submission, I'll find even the handbook and exactly what they did, because they have to have that as a requirement for publication. In case I want to double check.
Right. Okay.
Not all the studies, and this is one thing Indian studies do lack sometimes, but you need to, in studies, if I submit an idea of a protocol, I have to have that as
in the methods.
I have all of that, the details, what they did,
right,
to that degree of where another research independent can take that and repeat that and compare.
Because if you show that data, there'll be an immediate question: which yogasanas?
Correct. Yeah, they have, and exactly, and then they have to have a protocol anyway, and so they have to present it even when submit to the IRB, submit for funding, and then they're pretty much kept to task. The good reason why this they like the Western rigor is once it's in, you stick to it. That's it. You don't then change and chop. And what they find sometimes is if things start working, they chop and change along the way. Now I don't know what did what. Right. So even if it's negative, you finish the study. We learn from it. But if you chop and change, we're lost.
Yes, of course.
So that rigor is much harder here. It takes me so long to talk to anybody from India. I talk about research, unless they've evolved here, to explain that. It looks like what am I talking about? Because they want success. Because I think rigor is inbred here. And all your kids when they go to high school is inbred and cause inbred. They will be all. It's like your hygienist is ingrained. They will not break that rule. That's kind of why they trust studies here better, just because that rule is inherent. But it's still not fair. Some really good studies in India, and sometimes they struggle to publish in good journals. So I do think it's unfair. They improve so much more. And so I look at the studies and I use them, but you just have to be careful that we're being biased by tolerating that because of history, not because the standard that I would normally use for a patient. So I'm honest about it.
On the similar line for the Pariksha meditation,
So in the study specified which meditation was used and
Yes.
most likely contemplation.
Yes.
And so these were the patients who were newly introduced to the Pariksha meditation. So could we assume that effect might not be uh, as much as the trained or like the patient who has done that before?
I think you're right. I think, what unfortunately they can't study is the power. They can study physics. I can see you do it, how much you've done it, you put effort in. I can measure that. But I'm fairly sure there's a dimension that we can't measure, which is the power. I'm fairly sure that's important too, based on how we know the Atma works and everything works. So clearly that has to be, I'm doing it and I put the right effort and intent. And that's one thing you can't measure. You can just measure that they learned and they copied, right? And that probably explains why some people get such huge benefit. And some studies are just ridiculously good. You say, well, how did that happen? And then overall, I give you meta-analysis, average out all the studies. That's probably where the truth is, right? The studies I should do, but some studies show dramatic effects, some show less. And you wonder whether, as you say, it's either not enough
Yeah.
practice or the power, or somehow we didn't instill that power in them. This is what they're putting effort in. So that's the nature of these studies. But yeah, to your point, I'm fairly sure if you did a proper training for 200 hours, then you did it, you get far better results. Absolutely no question about it. I'm fairly sure. And I think you get good at it, better at it. Your system modifies and restructures itself. Your blood flow gets better. The studies that we did with Samniji, we found that there at 6-8 weeks, a lot of the DNA changed. It wouldn't have changed before. It doesn't change in 2-3 weeks. It changed at that time, which means they really are better, like internally better. It's not just feeling better, sugar's better, the actual cell systems are better. And that, even if they stop, they'll last for several months before it wears off. So it's that powerful. It's actually making you a different person. And, but you can't keep doing it. Then you have to then it'll stay at that level, right? You just can't keep up and up and up. We can't be one every year. It's not going to be like that. Obviously there's a plateau effect. Any medicine is a plateau effect. But you continue it, and other benefits might occur. All the ones we otherwise know about. And I'm fairly sure that the yogis who do for long term probably don't need medicines. I'm sure they exist. Like I can't imagine people who are very good at it can't get off medicines, but you just can't promise it because the real world is what we're managing. Having seen the power of this, I can imagine some people have managed to get off medicines. I'd really mentioned even at HbA1c 9, they managed to get off medicines, with weight loss, combination of things. So I do think they're very powerful techniques. They structurally change you, but slow and easy. They get there slowly. But, we need to all do this, right? This is our heritage and we're not doing it. And we're getting sick with the diseases that these are designed to protect us from. And we go into the Western medicine instead and listen to them and listen to what they're saying. Ours is far more powerful. But somehow we've lost this trust and momentum in our own heritage, which is so much more wise.
It has to do with patience too. We want immediate effects. We don't have the patience because yoga, meditation, they take time to bring out their effects. And modern medicine is almost immediate, at least provides that relief immediately.
But it's also very convenient, right? The medicine, just take the medicine and forget about it.
And that's why I don't compete with it. I think we used it, but we incorporate this as a prevention, right? That we should be doing regardless, because there's no medicine then. But when they're on medicine, we still incorporate there's the basics of our taking medicine, right?
Yeah.
So it's bewildering how we as Indians have thrown all this away. Not our fault, just generically. It's happened for lots of reasons, but we basically thrown it away. And we're almost learning from our Western colleagues. That's our wisdom. So it's just bewildering. Think about it. It's really not that difficult. Not difficult to learn, not difficult to do. It's cheap. A yoga mat. If you don't yoga mat to your blanket, right? And really, education, a lot of people provide for free. It's not something that people make money out of anyway, right? It's not one of those things that you have to go to an expert physician who charges you hundreds of dollars per hour, right? But we don't seem to associate that with greatness. We think that is, I don't know what we think. It's just bewildering, I find it bewildering. The joke was we did a program in Najibabad in a school, and we helped manage ADHD in like hundreds of students, right? And I had, my kids, my nephews, we trained them and they trained the kids there how to teach their compatriots who are not studying properly how to yoga, right? So kids from here taught them there. Then when we finished and they did really well, we took them a trip to Haridwar because that's the source of yoga. Guess how far Haridwar was? 50 kilometers away. That's the universal center of yoga. And a school 50 kilometers away was not applying it. It was a Hindu school. And I had Americans teach those kids how to do yoga. The whole thing was like a joke, to me, like, what is going on here, right? So somehow the British Raj probably destroyed it. Who knows? We just haven't really, I'm not blaming us in general because we're very bright people. It's just somehow it's just destroyed. So I feel what we're doing is serving that, and get that back and put this high in the pedestal and own it. And it's ours. Anyway, that's my pitch. I'm sorry, but it's my big bug that I feel a little bit like doesn't make sense to me as I'm Indian, but I was born in Africa and England. My back, they said, what is going on here? It didn't make sense to me that this is the ancient wisdom from our best yogis. Even if not Jain, they still know Maharaj Bhagavan is the best yogi ever. Everybody knows that. Nobody questions his level of yogi. And the best of the best recommend these things. He did some might say 83, 84 poses, Maharaj Bhagavan, right? So it's not like it's not inherent in our culture. Somehow we do this divas, we don't do this, right? This is far, far more important for us in every single way, I would think, than some of the kriyas we do. So somehow we do rethink and reawaken our folk, wake up, this is really your heritage. As you see, future studies, I tell you what we talked, other big diseases coming up. It's ridiculous we're not doing this. This is one big disease, other ones coming up, others already did. It's phenomenal benefit, right? And prevention, particularly. You'll not get sick is what it's going to do. That's what I think about prevention. Any other questions?
One more point, go ahead.
Sorry, I had a quick question. Yeah. Does the age matter when you are comparing these studies, like people who've had diabetes for a long time, and then they start saying, hey, I want to change myself. Does it matter how severe, do you do the yoga? Does it help more in the beginning or as the disease prolongs? Any information on that?
Well, I can tell you that quite a few studies had older people and still had that benefit. So I think any age will work. But to your point, yes, the earlier we start, the more preventive it is, right? And I can correct things maybe sooner. Maybe that it is less damaged because over time it gets more damaged. So I think definitely earlier start makes sense. But it doesn't mean it won't help an 85-year-old. Like it will work because the mechanism is still the same, right? They're still breathing and heart and kidney and pancreas. So if I reduce the stress, cortisol, I'm still going to see that benefit. So the physics inside is still the same. I do the same surgery, the same sutures. I don't change things because of age. You still get the same blood pressure, medicine's the same, my treatment's the same. The only difference could be that my pancreas is more exhausted, and so I have less ability to bring it back, but I can still see an improvement. Yeah.
Thank you.
I think it's unique in that way.
Because we may have different people who would come in the class or whatnot, and they may be at different stages of their disease, but the study applies to everybody.
Everybody, because the studies didn't exclude that. The only ones they exclude ones on insulin just because they can't stop it, but that's already too late. Even then, you can help by composure and stress. You don't offer promise for the medicine, you offer promise they'll be more calm, less stress, and manage their disease better. That's very important because that's half the burden in life, right? The mental part. That you can help in anybody. That's maybe the bigger part. At some point, what I take, don't take. But I'm feeling better is the bigger part, I'm 10% less, but I'm still taking medicine. But if I'm feeling better, definitely a much bigger part. My quality of life is better. So I think that would be, more important goal sometimes. I think.
And can you tell me where the pancreas is exactly located? Like when you say Paschimottanasana, is it right in this?
So if you look at your abdomen, where your rib cage ends, and go left, it's there, but all the way to the back.
I see.
It's all at the back. It's what we call retroperitoneal. So it basically, when you get nasty attack, often the pain's at the back, not here or up, because it's where it sits. It doesn't actually sit at the front. So when I'm doing my twists either way, I'm affecting its blood flow and helping it.
Okay.
And so pancreas is an important organ because it does diabetes and also digest your food. So it's two different things, very important. They're next to each other, different, but they live next to each other.
Okay.
And it's fairly large, right?
Hmm?
Fairly large. The plant.
It's long. Yeah,
Long.
it's long. Yeah, it's long. And it comes right to the midline. And
Like a triangle.
Yeah. It's a very feathery organ. It's a tree with the branches. It's like a leaf, three-dimensional leaf. It'll look like that with a head. But it's very easy to put fat. It's another place we store fat. If you have extra fat in our system, that's another storage place. Our system has to put it somewhere. Once your belly fat goes up, it has to put it somewhere. And that's one place it puts it. So it's open to fat coming in and disturbing it. That's why you want to avoid that belly fat. Like you're doing great, but many of us have a difficulty avoiding belly fat. So you have to work on yoga again. Right. Anita, you had a question?
I was just adding a point like we were not familiar with all the studies, so that could be the one of the main reason like the Western people don't know the importance of yoga and meditation in curbing these diseases. So as we share with more and more, there might be a change in perspective.
I hope so. That's why you're being trained. But I hope so. That's why I'm giving you boring data. Not boring, but because I think even if you remember a tenth of it, but it exists and you remember part of it, you'll be that more convincing. Oh, I know I've heard data, and you can where to look for it. Because even I won't remember it, after a while. But where it was presented, and we discussed it, and that'll give you that confidence. What happens is when you talk, you're confident, right? You have no doubt that this is going to work, right? Whereas other things says, I've heard from India, yogis, which is great, but this is a different level of confidence adding to what the yogis said, Then when they said it so well, we can improve it. Right? And all the people here are brought up with the same thinking. They need evidence.
Data is the currency of the trade.
Yeah.
And that's what I live by. So that's what I do. So but even your kids, everybody they'll argue back when it says data you watch.
Yep.
That's how they're trained. Which is correct. Doesn't mean you don't distrust ancient wisdom cultures, but at least you start up with data.
Is yoga just preventive for the diabetes, or is just cures as well?
So it's preventive and it helps. It reduces, maybe if you're lucky, the need for
It prolongs time. Basic.
Yeah, the
is
time.
it?
Yeah. The studies we show only goes that far, but what I think is that if you have the right power and you put more effort in, there are cases where they seem to get off medicine. So I think it's possible, but you can't promise that because
Okay.
it depends on individual effort, and maybe takes 3 years and a lot of time, and that's always going to be there. They lose a lot of weight, and really some cases where even at HbA1c9, which is really bad diabetes, there are people who got down to normal or almost near normal with weight loss and all these activities. So I think it's possible. Just have to not promise that yoga itself can do that.
Okay.
You have to combine things.
Okay.
So if you combine things, then how often they need to do the blood test to check what is the A1C level or?
A1C is a 3-month average. So A1C is kind of giving you all your blood sugars daily for 3 months average. Right. If your sugar went high yesterday, low, it wouldn't tell you that. It tells you on average over 3 months what's your sugar load been, sugar levels be. So you have to wait at least 3 or 6 months to compare changes. Because doing early is meaningless because it's going to overshadow what you already did before. Yeah. Good question.
Thank you, Dr. Devendra. It was really very wonderful talk, and you have supported yoga also by mentioning all different researches on different mudras, asanas, and breathing exercise. So now we are very, very much confident that what course we are offering, that is not just based on the ancient wisdom, but it is also scientifically proven. To some extent, might be we will have some more studies on these different yoga practices with time. But yes, it is not just based on some ancient wisdom, which is not proven or which has no data. So it is true. You have done very well with the presentation on this research, how it is going on different yogic practices. So thank you very much. And it is, of course, we have to combine because there are so many factors which work behind everything. So sometimes some other alternative things can also work and can also help apart from the yoga. So we should not be completely dependent on one thing, but yes, if it is helping and your health is getting better by practice of the yogic things, then you have to continue with that also. So thank you very much. Now it is the time for meditation. Who is ready to give the session? Yes.
I'll do perception of psychic colors today. So we'll start with the meditation. So comfortable position, Gyan Mudra. Gently close your eyes, spine, neck, head straight. We'll start with 3 Om Dhwanis. Inhale. Om. 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 Resolution for the meditation. I'm practicing Priksha meditation for the purification of my psyche. I am practicing Priksha meditation for the purification of my psyche. I am practicing Priksha meditation for the purification of my psyche. We'll start with the relaxation. Kai Utsak. Make sure your entire body is steady. There is no movement in any part of the body. And you are fully aware of your surroundings. Concentrate your mind on the big toe of your right leg. And spread it on the entire toe. And provide auto cessation to relax. Moving to the rest of the toes. To the sole, heel, ankle, calf muscles, knee, thigh, up to the hip joint. Your entire right leg is completely relaxed. Moving to the left leg. The left big toe. Rest of the toes. Sole, ankle, calf muscles, knee, thigh, up to the hip joint. Your entire left leg is relaxing. Your left leg is relaxed. Moving to the mid portion of your body. Lower abdomen. Intestines. Kidneys. Pancreas. Diaphragm. Rib cage. Heart. Lungs. Chest. Up to the collarbone. All the internal organs are relaxing. Your back and spinal cord are relaxing. Moving to the right hand. Your thumb, fingers, palm, wrist, lower arm, elbow, upper arm, up to the shoulder. Your entire right hand is relaxing. Your right hand is completely relaxed. Now we'll move to the left hand. your left thumb, fingers, palm, wrist, lower arm, elbow, upper arm, up to the shoulder. Your left hand is relaxing. Your left hand is relaxed. Now we'll move to the upper part of our body. Your neck muscles, throat, vocal cord, chin, facial muscles, jaw, tongue, nose, ears, both the eyes, forehead, brain, and the entire head. All the parts are relaxing. Now just be in this state for a couple of breaths and observe the relaxation of entire body from toe to head and head to toe. Now we'll move to the next step, perception of psychic colors. With your mind's eye, visualize that everything around you is bright emerald green color. Now take a deep breath. As you inhale, visualize that you're inhaling that bright green color. The bright green color is entering through your nostril into your body. Continue the breathing. Now concentrate your mind on Ananda Kendra, center of bliss, located near your heart. And visualize the bright green radiations are spreading in that psychic center. And it's covering the entire area up to the back. Now visualize the particles of bright green color are emanating from the center of bliss and spreading all around you. The bright green particles are covering your body and your aura around you. Now, using auto-suggestion, realize my emotional pattern is being purified. My mind is being purged of all the negative attitudes. Practice sustained visualization with deep concentration. Now we'll slowly move to visualization of bright blue color, color of peacock's neck. Take a deep breath, and as you slowly inhale, visualize that you are breathing long streams of bright blue air. With every breath, the bright blue color is going inside your body. The air is bright blue. Now concentrate your mind on Vishuddhi Kendra, center of purity, situated in the middle of your throat, and visualize bright blue color in that center. Visualize that the bright blue radiations are spreading in the psychic center, covering the whole portion up to the back. Now visualize the particles of radiations of bright blue light are emanating from the center of purity and spreading all around the whole body and the aura. Now using auto-suggestion, realize my sexual impulses are being brought under my conscious control. Now with your mind's eye, visualize that everything around you, including the air itself, is colored bright red, like the color of the rising sun. As you inhale, visualize that you are breathing long stream of bright red air. Now concentrate your mind on the center of intuition, Darshan Kendra, situated in the middle of both the eyebrows, and try to visualize bright red color. Perceive bright red light and visualize that the bright red radiations are spreading in the psychic center, covering the whole portion up to the back. Now visualize that the particles of bright red light are emanating from the center of intuition. They are spreading all around, covering the whole body and the aura. Now using auto-suggestion, realize my intuition power is developing. Now with your mind's eye, visualize that everything around you, including the air itself, is colored bright yellow, like sunflower. As you breathe in, visualize that you are breathing long streams of bright yellow air. Now concentrate your mind on the psychic center of knowledge, situated on the top of the head, and try to visualize bright yellow color. Perceive bright yellow light and visualize that the bright yellow radiations are spreading in the psychic center, covering the whole portion of the brain. Now visualize the particle of bright yellow light are emanating from the center of knowledge and spreading all around, permeating the whole body and the aura. Now using auto-suggestion, realize my perceptive capacity is increasing. Now, with your mind's eye, visualize that everything around you, including the air itself, is colored bright white, like the full moon. As you slowly inhale, visualize that we are breathing long streams of bright white air. Now concentrate your mind on the psychic center of enlightenment, situated in the middle of the forehead, Jyoti Kendra, and visualize bright white color. Perceive the bright white light and visualize that the bright white radiations are spreading on the psychic center, covering the whole portion up to the back. Now visualize the particles of bright white color are emanating from the center of enlightenment and spreading all around. Permeating the whole body and the aura. Now using auto-suggestion, realize my anger is waning away, my passions and emotions are being pacified. I'm feeling complete tranquility of mind. Now we'll take 2 Om sounds. Deep breath. Rub your palms and put it on your eyes. Conclude the meditation. Om Aram.
Thank you. It was wonderful session.
Devendra madam,
Good instructions. Thank you. Have you seen, anybody has seen the color?
Yes, it was wonderful, Samniji.
Wonderful. Okay.
Nicely done, Anita. Very nice.
Thank you.
Very impressive.
So tomorrow who is going to give